Coronavirus is a family of viruses that cause anything from the common cold to severe respiratory illness that has been around for centuries. But why we're talking about it today is a new strain of coronavirus was discovered in December in China, and that is the new strain that we hear about on the news. It's also called COVID-19. The main symptoms of this new coronavirus are cough, fever, and shortness of breath. What I know many of you want to know is coronavirus going to come to Johnson City? Is it coming to our community? We don't know for sure, but most likely yes. Most likely we will see cases locally. It is very important for everyone to remember, though, that most of these cases will be very mild. Most patients that get coronavirus do not require any sort of medical care. Most patients need a few days at home, some rest, hydration, maybe a little bit of Tylenol, and that's it, and make a full recovery. Now, there are things that you can do right now to help keep you safe now and in the event of a coronavirus outbreak. The most important thing you can do is wash your hands. Wash your hands many times a day, before eating, before preparing food, after using the restroom. Wash your hands if you cough, if you sneeze. Anytime you think about it, wash your hands. Next, in terms of general health, I recommend getting a flu shot. Flu season is still rampant in our community, and flu is still a big threat for us, and it is not too late to get your flu shot. The flu has killed many times more Americans this season alone than coronavirus has killed people worldwide. So getting a flu shot is very important for your health. Next, I recommend getting a primary care physician. Many of us don't think about going to the doctor when we're healthy. We think about it if we get sick, but this really is the time to start a relationship and establish care. It'll help your doctor get to know you, and it'll also provide you with easy access to a physician if and when you get sick, because we all will get sick with something at some point. And lastly, if you do get sick with any type of illness, please stay home. Stay home from work, stay home from school, get a little bit of rest for yourself. This will help you get better faster and will also help the community as a whole to not spread different illnesses around. One thing I do want to reassure everyone about is that this coronavirus tends to be very mild in children. I know that we all worry about our children, those of us that are parents, and children have contracted this illness. However, it has been very mild in children. And that is something that's a silver lining of this, and something that I do feel very confident reassuring you about, that your children will be okay. So a few take-home points that I want to make sure everyone hears. First and foremost, wash your hands. Next, we recommend that you go to the Centers for Disease Control and Prevention and the World Health Organization websites for up-to-date information. This is a rapidly changing illness. Information is changing constantly, and that is your best source for reliable, up-to-date information. We at ETSU Health and the ETSU community as a whole are committed to keeping you and your family healthy and safe, and we are also committed to keeping you informed about the coronavirus.